Welcome back. We are answering your questions about the coronavirus with Chief Pharmacy Officer at Cone Health, Dr. Deanne Brooks, and Dr. Jay Ravishankar with Cone Health Alamance Regional Medical Center Infectious Diseases. All right, Dr. Brooks, this person says, I'm a healthcare worker and would like to know, do I have to take the vaccine if I don't want to?
So that's going to depend on where the individual works. I can share that at Cone Health, and I believe in the Triad region, that we are not mandating our employees to have the COVID vaccine right now, and it is their choice. We're offering it to them.
Okay. Dr. Ravishankar, this person says the storage temperature is sub-zero for the vaccine. I would assume it is brought to a more human-tolerant temperature for injection. Is this true?
Yes, absolutely. Once they reconstitute it, meaning like they will, it's in powdered form, it will be mixed with saline, and then it will be, I guess, Diane, it must be saline, I guess, right?
Yes,
and then
it is
yeah, it is reconstituted and it is actually kept in it can stay in the refrigerator for a few hours after reconstitution. So definitely it's not going to be sub-zero. They will reconstitute it with saline. Yeah.
Good to know. Dr. Ravishankar, this person's asking, and since I asked you the other question about sensitivity, this person says, will the corona vaccine be safe for someone that has lupus?
We need more data. We have to the clinical trials data has not been published yet. And so we actually don't know in that population of the 44,000 folks that were taken for Pfizer and the 30,000 or so for Moderna. We really don't know the characteristics, like how many were immunocompromised. We do know generally that more than age 65, they worked well. And so we have to get more data and more information about that before I can safely say to you, yeah, go ahead and take it.
Okay. Dr. Brooks, this person says, I am 64 years old. Would I be in the elderly group and be able to get the vaccine before the general adult public?
So right now, the next phase will be with individuals who are greater than 65 years old or people who have two chronic healthcare conditions. So if you're less than 65 years old and have two chronic healthcare conditions, you might be in the next phase of administration.
Okay, good to know. This person says, my family got tested for COVID-19, myself, wife, and daughter. How is it my wife was the only one tested positive and she works from home and I'm the only person who really leaves the house? Dr. Ravishankar, you want to take a stab at that one?
Sure. Repeat the question. You said the husband and wife, the wife got positive. She stayed at home. Is that what you're saying?
Yes, and he's the only one who leaves the house.
Okay. Well, if there is, it is even though you are in the same household, it all depends on what your exposure was outside. So if you had been masking consistently and correctly, because the masks have to be pretty much covering your nose and your mouth, as well as hand hygiene, hand washing, and distancing, then you could have been an asymptomatic carrier, and then your wife could have gotten the infection if you had it, if you did not exhibit any symptoms.
So, although he didn't test positive. Yeah, I don't know. So let me follow up with this because this person says, I tested positive. Is it okay for me to still cook for my family?
Well, that is an interesting question because if you're testing positive, you're supposed to be you're isolating yourself at home. You're going to be using a separate room, bathroom, and not actually doing cooking or sharing utensils or food with others. There must be somebody else who should be doing that for you. In the circumstance where you're not able, there's no one else, and you have small children, then you may have to, if you're symptomatic, I would still recommend you having not to do that. But if you're asymptomatic, I guess protection, washing hands, masking is important. But usually if you're positive, you have to isolate yourself at home and not cook.
Dr. Brooks, this person says, will there be a charge for people without insurance?
So right now the vaccines are going to be offered free of charge, and so they will be able to receive the vaccines.
and this person is saying, can you still transmit the virus to others once you have the vaccine?
If you get the vaccine, you should expect antibodies to develop for the vaccine, and then at least in the clinical trials, there has been one case of in the placebo group there were more patients, but in the people who got the vaccine there were a few cases of asymptomatic as well as mild disease was noted. So yes, you should have to mask, and you should still have to follow the 3 Ws, masking, social distancing, as well as hand hygiene. And you may be, if you get the infection, you may be able to transmit to another person if you're not masked. That's why immediately after vaccination,
Okay, great.
masking is necessary.
Yep, and we got those 3 W's in there, right there at the very end, which is great. All right, thank you for joining us today, doctors. Thank you for sending in your questions.